Hello everybody, I am Sasha, the producer of the song that calls you home, and we are back with the song that calls you home conversations. And today we have an amazing guest and an old friend, Dr. Sam Coe. And we are going to dive a little bit more into crossbreeding different modalities and also a little bit on the medical side of what that's like to work with ayahuasca and the allopathic medicine perspective, and a little bit more information from the inside. And also we are going to introduce a new topic of ketamine and also SGB. And we will have Dr. Coe talk a little bit more at length of that and introduce us to those new modalities, or new for some, and also talk about how they interconnect and support each other with the plant medicine, and in particular with ayahuasca. So thank you, Sam, for being here today with us. And give us a little bit of introduction and how you came to, what's your background and how you came to ketamine, how you found out about plant medicine, and what actually was the inspiration to research that topic, and tell us about SGB and what that is. And yeah, not even gonna try to
Okay.
butcher it.
Well, first off, I'm really excited to be on today's show. It's really a privilege and honor working with both you and Luis over the years. A little bit about my background. I'm a board-certified emergency physician. Been working in the emergency departments for about 15 years. And I'm also the founder of Reset Ketamine here in Palm Springs, California, where I really focus on IV ketamine therapy for treatment-resistant mood disorders, mental health conditions, chronic pain disorders. And the other thing that I'm really passionate about is something called the stellate ganglion block, SGB. We'll just call it that for just to shorten it. But it can really help reset the sympathetic nervous system. And I think the combination of ketamine, stellate ganglion block, these traditional Amazonian plant medicines like ayahuasca can be transformational for a lot of patients. Especially, we know that there's suffering in the world.
Yeah.
There's a lot of pain in the world. And I'm pretty open-minded. Rather than sticking with one thing, I really think it's important to broaden our minds to the full spectrum of what's available to heal. And so this led me to learn more about traditional Amazonian medicines and explore, like, how can we help people? How can I help myself? How can we bring this game-changing medications and medicines to the people who need it?
And was there a personal catalyst to that? That was that what you've mentioned, mind opener, like, wait a second. Was there a moment where you're like, okay, this is how much we can do? And like, what else is available? What else is there? Was there something like that in your life?
Yeah, so working in the emergency department was challenging because in addition to heart attacks and car accidents and trauma and strokes, we also had a large population that suffered from mental health. For example, suicide attempts, overdoses, just a lot of pain and suffering.
Yeah.
And what I realized is that traditional allopathic medicine is great, right? If someone's having chest pain, you don't want to do acupuncture or chiropractic. Like, no, let's get you to the emergency department and help open up possibly a clogged artery. However, it has limitations, right? It's a great tool, and it's one of the tools, and I'm a big believer in it. But I think some of these chronic conditions, especially in the psychiatric world or chronic pain world, I think we need to open up our minds and explore alternative treatments. And that really led me to, what I'm doing now, and considering not only the Western traditional allopathic side, but also the non-traditional complementary alternative medicines that are out there. Personally, for me, working in the emergency department was challenging.
Yeah.
Right?
Stressful.
Very, very stressful. They did a recent survey amongst all the different medical specialties.
Yeah.
Looking at, hey, which specialty has the most amount of trauma or depression or burnout or substance use disorder, anxiety, etc. And the bottom line was that they found, out of all the specialties, emergency medicine, we have the highest rates of burnout.
I can imagine.
So
no turn off button.
I think the estimates in that study was 2 out of 3
Yeah.
emergency physicians have burnout. And accordingly, for me, I also suffered from burnout. I felt like a part of my spirit was dying. I would see patients and resuscitate them. And I mean, frankly, to be honest, there was PTSD related to the things that I have seen. And I didn't really process it and understand it, but my body knew. So consciously, I was like, oh yeah, it's not a big deal. I would go see the trauma or the car accident patient or the stroke. 2 minutes later, someone, let's say, passes away. And then I get maybe a minute or two to process that. And then boom, I'm into the next room taking care of the little kid with a cough and runny nose.
Wow.
So all of that just built up. And eventually I was in a point where there was just a lot of suffering in my life. I wasn't taking care of myself. I was very unhealthy. I was probably 30 pounds overweight. And that led me to explore alternative treatments. And, you know, I did a lot of things. And one of those things was going to Peru and the Amazon and exploring the indigenous cultures and working with shamans there.
Oh, wow. Oh, wow. Okay. And what was your takeaway like from that? This is so different. What was that like to discover, and what was the main, would you say, difference that you've experienced? And first of all, was it effective for you? Did it help?
Yeah, so when I went to Peru, this is back in 2013. And so we're shooting now, it's 2025, so I guess 12 years ago. And I would say, I mean, it was just so much. I was there for about 2 weeks at a wonderful, amazing center. And I mean, if I had to distill it down, I would say that it was like my wings before I went there were broken. And when I left, my wings were still broken, but they were mending. And I had a vision of being in a golden eagle specifically.
Oh, wow.
With the wings that were bandaged up and in the process of healing, but they were completely broken. And I wasn't able to fly and be the person who I really needed to be. So I would say that vision for me specifically of seeing the broken wings and then the mended wings was really powerful for me. And that kind of led to the reset ketamine formation, because if our logo is a reset button with wings.
Interesting. I have not heard this before from you, and we can edit it out, but is this the first time you're mentioning openly about going to Peru?
Yes, it is.
So that's the big coming out.
Yeah.
Oh my God, congratulations.
If there's anyone I would do it with, it would be with you and Luis.
Oh my God. Thank you for this. This is, yay. This is really an honor to be here for this and to hold space for this big news. And I really do believe that, you know, more and more I personally meet people in the medical sphere and also in the sphere of recovery, where I feel like there's this new energy where it's like people are kind of coming out and saying we need, like, you know, we need these people on board. Because I mean, I'm an artist, right? So I was like, what I know is like holds only so much weight because it, you know, because of the way that our social structure works. And so I think it's really, first of all, it's courageous to say that. And this is also what I wanted to talk about. What is it like to be a medical professional, to be a doctor, to go through such a vigorous training and also work in emergency room? And what is it like to do the medical community? What is the general attitude toward the ketamine, toward, any kind of psychedelics toward plant medicine? Are they open-minded? Is it conservative? Like, how is it?
That's a really good question. And I would say when, we use the word psychedelics, there's a bunch of different options, right? So we have ketamine, we have psilocybin, we have ayahuasca, we have 5-MeO-DMT, we have MDMA. And some of those are considered classical psychedelics. Other people are saying that those are not psychedelics. But regardless, they are psychotropic medications. And as far as the medical community attitude, I would say there is definitely a bias against traditional medicines, whether that's acupuncture or traditional Chinese medicine or chiropractic medicine. Like there is a bias inherently. Now, what's interesting about ketamine is it's a really old medicine,
Yes.
right? It was invented in 1962 at Wayne State University by Dr. Calvin Stevens. It was FDA approved in 1970 for use as a general anesthetic. So physicians and medical community were really familiar with that medicine. So accordingly, the medical community is open to it, I would say more than these other traditional medicines, because those are, according to the, number one, they're illegal, right?
Yes.
They're Schedule 1 substances. So there's not a lot of research because since 1970, when the Controlled Substance Act was formed, it became illegal. So all the research was halted for about 30 years. And that means that there's a bias against it. There's not as much robust data and scientific evidence. And I would say it's not as well known. And it's probably in general looked down upon, right? In the mainstream medicine. I mean, that's the reality of it. However, there are pockets of clinicians and therapists and psychologists who say, yeah, actually, this can be effective.
Yes.
And whether it's helped them personally or they've seen their clients or patients get better, I think it's like a crack, right? It's like a crack that's opening up.
Would you say ketamine is kind of a bridge to have this conversation because of its relationship with the medical field, established relationship with the medical field?
Yeah, I think it can be a great bridge because ketamine does create non-ordinary states of consciousness. And one of the things with ketamine is it's unique in that it's not only the medicine, but the environment that plays a role in how effective it can be. And as you know, we refer to this as the set and the setting. And ketamine is unique because the set and the setting will impact the person's experience. Similarly, whether someone's using psilocybin or ayahuasca or any of these other alternative methods, like the set and setting play a crucial role.
Yes.
And accordingly, I think that can be a bridge. Now that we're familiar with, hey, yeah, we're working with non-ordinary states of consciousness with ketamine, how can we bridge that to these other medicines?
This is a great segue because there's a little bit of this, well, can we synthesize all the plants and just give them in the medical field like a pill? And will that have the same effect? So how do you work with ketamine, and what are the elements that you find, like, for example, sound, music, right? Like, can you talk to that, like how that is in your experience affects the journey and what role it plays?
So I think music is really underrated in therapy. And we don't really use it traditionally in the hospital setting. But there was a fascinating study done in the 1980s, I believe, where it was a study on music and ketamine administration. So they gave two groups. One group received ketamine prior to their surgical procedure by itself and with the traditional anesthetics. And the second group received music of their selection plus the ketamine and the general anesthetics. So one group got music, one group did not get music. And what they found was that the patients who were listening to a song or music that they enjoyed had a much more pleasant experience with the ketamine administration. So we know that with shamans in the Amazon or area, like the song is really crucial, right? We call them Icaros, and you're much more intimately familiar with this. But the ikaros are the songs that the shaman will chant and sing with very specific intentions,
Yes.
whether it's targeting certain diseases or spiritual illness or whatever it may be. So I love how they incorporate the song into their therapy. And at our clinic, we incorporate music.
Yes.
And we have Bluetooth noise canceling headphones. I've listened to thousands of songs, finding the right playlist. So mine include some binaural beats, theta waves, chakras 1 through 7. So this is a little bit alternative. You know, we're in California, so I'm allowed to be kind of out there. But I find that the music and our patients say, hey, Dr. Ko, that soundtrack, whatever you played,
Yeah.
really hit the right frequency.
So can you walk us through how you approach and what a session, ketamine session with you is like, and how did you figure it out? How did you come to this? Was it like this from the beginning, or was there an evolution as to like what is the most, I wouldn't say even the word effective, what is the most people get, experience-wise? How can you walk us through that
Sure.
process?
So how it works is a patient will reach out to us,
Mm-hmm.
and then we will do a interview with them, like a consultation, and then we'll see if they're a good candidate.
Mm-hmm.
So ketamine is great, but it's not for everyone. So
And
there
what
are
does that
certain
mean? A good candidate?
they may, if for example they have a history of schizophrenia,
Uh-huh.
that would screen them out. If they have uncontrolled hypertension, that would screen them out. If they have certain other illnesses like kidney failure or severe cardiac disease, we would say, maybe it's not a good fit, or maybe you need to get a cardiology to clear you prior to it. And sometimes maybe they're just not ready, right? They're just curious about it. So they'll do the consult, but they're like, yeah, I'm not quite ready for it. So a lot of patients will reach out, and then we'll find the right ones and for the therapy. So in addition to the medical side and the psychological side, also I want to establish a good therapeutic alliance, because the ketamine sessions, having that relationship and rapport between the doctor and the patient, it's crucial. So there's also like a vibe check in a way. Now, once that's completed, then there's 4 phases of ketamine therapy. And I think about it as first phase, preparation. And so for about 5 days, we have preparation guidelines, whether that's, decreasing social media, meditating, being in nature, journaling, yoga, like whatever it is, just to get them into the right mindset. And then the second phase is the intentions. So having a really clear goal and idea of why are they pursuing ketamine treatments. The third phase is the experience. So that's when they actually come into the clinic. We monitor their vital signs. We almost create like a ritual or ceremony around our ketamine sessions. And then the fourth phase is the integration phase, where we'll do a brief integration session right after the ketamine session, because there's some neuroplasticity that we can take advantage of. And then they'll engage in psychotherapy or integration coaching for the long-term retention of the insights or ideas that they've gained. So it's not just the ketamine.
Right.
It's actually the entire process itself. And I refer to that as practicing the biopsychosocial spiritual model of medicine.
And my understanding is that it's not how it's done everywhere. This is you developed a particular approach, and was that approach in any way influenced by your experience in Peru? Because it sounds very similar to like this idea of preparation and setting an intention, sort of kind of, really reflecting on our life and internally, taking a little bit of time to...
I would say it not only comes from my experience in the Amazon, but it comes from my entire life.
How so?
And like as an example, when I was in medical school at University of Rochester in New York, they actually founded the biopsychosocial model of medicine. And that was founded by Dr. George Engel, who was at University of Rochester. So even throughout my medical curriculum, we learned that when we're treating patients, it's not just the biology, it's not just the DNA or the proteins or the inflammatory markers, but to consider the psychological factors and the social factors. And then after that, I did my training at Loma Linda University, which is a religious institution. It's Seventh-day Adventist.
Interesting.
And there was a component of spirituality that was brought in. As one
Ah,
example, I saw one of the trauma attendings. He literally prayed for his patients
mm.
during their recovery. I remember we were all following him around because that's what we do as residents. We follow the attending. And he said, "May I pray for you
Oh,
and your
wow.
healing?" And I was like, wow, not only do I have the biopsychosocial, but now let's throw in the spiritual.
Yes.
And I think in addition to the experiences in Peru, the experiences from my medical education in med school, the experiences from residency, all of that just kind of coalesced.
Hmm.
And for me, I've taken a lot of courses. I've read a lot of books. I've probably spent, I don't know, in just education, probably $500,000. And what I do is I take tools from here, I take tools from here, I take tools from underground practitioners, I take tools from the Amazon, I take tools from neurolinguistic programming, from um, leadership courses, speaking courses, and I just bring them all together to provide this treatment at Reset
Mm-hmm.
Ketamine. So it is very unique and different.
Yeah.
And you had mentioned, Sasha, that you're an artist.
Mm-hmm.
And in a way, I see myself as an artist as
Mm-hmm.
well. The art of medicine.
Yeah, that's amazing. The art of medicine. I love it. And it's exciting for me to hear this idea that, this idea of prayer. Well, not maybe everybody would resonate like from religious perspective, but this idea of spiritual, I just really love that because part of what I believe is so effective about the approach of shamanism is because they don't take apart emotional, spiritual, and physical. They look at it as like a whole. And they're saying like, okay, so how do we integrate back this taken apart, kind of like you've mentioned, broken piece and put it together because all of these elements is who we are. And so it's just so exciting for me to hear that there are studies and people and doctors who are practicing in that way. And, I would really love to see some data. It's like, how are the patients doing? It's like, is this like in any way effective? Because I personally, like, whether religious or not, but it would be amazing to like have a doctor who's like, you know what, can I pray for you?
Right.
That is just, yeah, like that instant connection and sense of care, being cared for, versus just like a subject or an object that you are and then being, treated, prodded, and all these things. And it would be amazing, I think, to see a study if that actually promotes a better recovery.
I mean, it's amazing and that the mind will affect the body and the body will affect the mind. And in my belief, there's also the spiritual, which contains everything there, right? And I understand why we do it,
Mm-hmm.
right? So, one of the examples that I think about is if we go to Google Maps and we look at, let's say the border between California state and Arizona state. If I look on the maps, there is a clear delineation, like this is California and this
Mm-hmm.
is Arizona.
Mm-hmm.
Now, when we actually drive to that border, there is no dark
Exactly.
line. It's all connected.
Yeah.
Similarly, with the mind, body, spirit, I believe it's all connected.
Mm-hmm.
However, to understand it and to simplify it, I think this is why we break it down into
Mm-hmm.
these different areas, because it just helps us process it a little bit
Yeah.
easier. So it's more for an understanding. It's a map, but it's not the reality of what truly is.
Mm-hmm. Exactly. And would you say, like, for example, like people who, so from your experience working in the ER, do you believe that, for example, SGB modality or ketamine modality could be helpful for people who are primary caretakers for other people to manage their stress, to be able to calm down, to be able to regulate their own nervous system and process? And do you think that maybe possibly there is a more effective way of even having these modalities to even run the ER that takes care of the caretakers better than it is today?
I have a good colleague of mine, and he was an emergency physician, and I interviewed him on our Ketamine Startup podcast recently, Dr. Mel Herbert, and he's very public about this, so I'll
I've
share.
seen that one.
And thank you for watching. And he told me that he practiced emergency medicine and he was at like USC, which is probably the largest trauma center in California. And also, like, they just see the most intense stuff. All of that trauma just built and built and built and built for his entire career. And he didn't really process it. But when he retired, all of a sudden, that's when all of these memories of the dead babies or the gunshot wound, and it just came and came and came. And he's like, I just can't get these thoughts. He was actively suicidal. And he tried the traditional medicines, SSRIs, SNRIs, etc. But fortunately, his primary doctor recommended ketamine therapy. And so at the end of his career, he was really suffering. Didn't know he was suffering because it's easy as a doctor just to work, and just push it all down. And by him pursuing ketamine therapy, he got significant benefits. And he is a really huge advocate for mental health amongst physicians because, you know, there's a statistic that 300 to 400 doctors die by suicide per year.
Wow.
And it's probably higher because,
Probably.
you know, it's kind of underreported maybe, or they don't want to share it. And doctors know how to, you know, in their life with minimal suspicion. So I anticipate and expect that number to truly be higher. So I think ketamine, stellate ganglion blocks for the traumas that we've seen and experienced can be a game changer and can really help people. And there are studies looking at this, whether it's ketamine therapy, group ketamine therapy, and they've literally done randomized clinical trials to say, hey, can this be effective for providers and doctors? I think about doctors and nurses and respiratory therapists and technicians. You know, if I zoom out and I see Earth as one body, I think about us as kind of the immune system, or we're the white blood cells of the human society. And when that white blood cell is not fully functioning, it's not optimized, it's not healthy, it's not going to do a good job of helping other people. So we really need to prioritize not only the physical health, but the mental health of clinicians.
Well, and it's also, it ties back into the idea of spirituality is that we can only like help or uplift if we are there. Right. And so if we're under a huge amount of stress and we are not taken care of, then we can only do so good for others.
Exactly. I mean, there's that classic saying, you can't pour from an empty cup.
Exactly. Yeah.
And so, yeah, for me, my goal really when I'm helping patients is to be 100% optimized. And maybe it's not 100% every day, but you know, 95, 92, 91%, so that I can bring my A game to help the patients. And if I'm not bringing my A game, if I'm bringing my D game or C game, like I'm probably not doing as good of a job as I can.
Yeah. Yeah. So tell us a bit about this AGB. I'm going to try to say it. It's a stellate ganglion block. So you're the person I've heard that from for the first time, and how new is it? What does it do? What is it?
Yeah, so it's the stellate ganglion block, and we have a portion right underneath the collarbone on the typically on the right side. And it's referred to as a stellate because it comes from the Greek word stella, which means star-shaped. And so there's a kind of a star-shaped structure right around the thoracic level 1 that is responsible for the sympathetic nervous system, in particular the fight, flight, flee symptoms. And what we can do is reset the sympathetic nervous system. The history is really interesting because it actually was first performed in 1925. So this is a 100-year-old procedure. And what they would do 100 years ago, because they didn't have ultrasound technology or x-ray technology, they would just feel someone's carotid artery, put in a needle, and inject a bunch of lidocaine, probably 30 cc's, into this neck portion, hoping to get into this rough area. And so they were doing it, we call it blindly, based upon anatomical landmarks. And at that time, they were using it for pain. So people can have an overactive nervous system affecting their right arm, for example, and they were using it for pain syndromes that are related to the autonomic nervous system. But then roughly in the 1980s, someone was receiving the stellate ganglion block, SGB, for their pain in their right arm from a gunshot wound. And what they found was that after they received it, their PTSD symptoms associated with that gunshot, creating the injury, just went down dramatically. And from that point forth, people were like, oh, this is fascinating. Maybe there's a component of PTSD and trauma related to the sympathetic nervous system. Of course, now we're like, yeah, duh, that makes sense.
Yeah.
And they've done randomized placebo-controlled trials looking at this procedure to help reset. And the benefits are quite robust. So, 86% effectiveness in reducing PTSD scores for 3 months out, 6 months out, really long-term benefits. And, I've been thinking a lot about like how this intersection of stellate ganglion block, ketamine, ayahuasca, like what is going on? Like what's the similarity and the differences? And what I believe is that whether it's the ketamine or whether it's ayahuasca, I think there is a component where people's sympathetic nervous systems are getting reset.
Yeah.
And the SGB is a procedure where if someone's, maybe they're just not into psychedelics.
Right.
And they're like, hey, I still want to get benefits. Maybe they have a lot of fear, or maybe,
Yeah.
they're just not vibing on doing something that's going to create non-ordinary states of consciousness. I think this is where the stellate ganglion block can really come in.
Yeah.
And whether it's like law enforcement, military, paramedics, firefighters, people who may traditionally not want to do something alternative, like, hey, they feel comfortable with getting a needle in the neck.
Right.
And getting their nervous system reset.
And it's entirely legal and...
Exactly. It's medicine that it's called ropivacaine. So it's a long-acting, it's like the lidocaine that, someone would receive at the dentist for a dental procedure. It's like that, but it's longer acting.
So like it seems like these three seemingly unrelated components, ketamine, SGB, and ayahuasca, they all affect nervous system. Can you, from a medical perspective, talk a little bit to what that means for our body, what the nervous system is really responsible for, and like how does it affect us?
Yeah, so the mechanism of action of ketamine, it works on the N-methyl D-aspartate receptor, NMDA, I'll just shorten it. And in particular, it has dramatic effects on glutamate, neurotransmitter. So glutamate is really interesting because it is about 90% of the neurotransmitter activity between synapses. Ayahuasca, on the other hand, works on the serotonin receptor, specifically the 5-HT2A receptor. So that's where the DMT from the ayahuasca will affect the serotonin system. And then third, we have the stellate ganglion block, which helps reset the sympathetic nervous system and also decrease activity between the brain and the body. And in particular, it targets the amygdala in the brain and also decreases inflammatory markers. So in a way, they're working on different neurotransmitters and different systems in the body. And at the end of the day, though, like what really matters? Right? So yeah, sure, we know the mechanism of action of this and that and this, but like for the patients, what really matters? And I think it's about resetting the nervous system, clearing blockages, maybe even, spiritual healing, psychological healing, biological healing. I think these medicines can be profoundly helpful for a lot of patients. Not for everyone.
Right.
But for a lot of patients who are suffering. And at the end of the day, that's what we're here for.
Right. And would you say, like from a medical perspective, that there is a link between, let's say, chronic stress in the nervous system and chronic disease?
Absolutely. Absolutely. Yeah. So cardiovascular disease would be the best example, right? It's inflammation of the coronary arteries, and that inflammation builds up plaque, and then it creates stenosis. And we have diabetes, which is a chronic disease. So there is a link between, increased inflammation and increased chronic disease. And we can reduce inflammation in many ways: exercise, meditation, what we consume, like what our diet looks like. Like there's many ways to decrease inflammation.
Yeah. And so, I'm a big proponent of people doing their own research and also being self-responsible. And what I've also realized talking with some people who went and experienced plant medicine, particularly ayahuasca, in different countries, that the protocols of screening are a little loose in some places. And can you talk a little bit as to like what people should know about their own, like how people lead themselves to determine whether they're a good fit for, because I believe that, you know, not everybody should participate, not only for some counterindications, but also like I believe like all of these things are if we're feeling resonance with that and we're feeling the calling, and that's how we primarily know that that's a good idea for us to maybe try something. And I feel like it's a blessing that we have such a variety of things available, you know, because not everybody's gonna go to Peru or drink ayahuasca, and some people are feeling more cold and safer with ketamine, and all of these things is just such a blessing that we have that. But what would you say that people should know, and how ayahuasca generally affects the body? What happens with this particular, because again, like you said, we don't have a ton of research and a ton of data to do like, you know, a regular person goes on the internet and like what, how do they, where do they go, how do they start, what do they need to know?
Yeah, I mean, that's a really big question. So what's coming up for me is that fortunately, you know, everyone has access, not everyone, but the vast majority of people have access to the internet. So we literally have the Library of Alexandria at our fingertips. So that would be a great place to start. And there is a ton of information. There's also a ton of misinformation.
Yes.
So choosing wisely what my resources are. And then, you know, when I think about ketamine therapy, like there's great doctors, and then there's probably not so great doctors.
Yes.
Similarly, there's great retreat centers, and there's not so great retreat centers. Or there's great shamans, and there's maybe not so great. So this is just natural, right? There's some people who know what they're doing, and then people who are just maybe, you know, don't know as much. So I think finding the right person, the right clinic, the right therapist, the right shaman, the right center, whatever it may be, is really crucial. And, you know, trusting your own intuition and wisdom of like who feels right, because that's also another clue, is trusting our bodies and our own gut intuition. So finding the right people, doing the research, trusting yourself and making those decisions would be crucial, because a lot of these experiences are quite vulnerable.
Yes.
Right? Even when someone's getting ketamine therapy, they have the eye shades on, they're reclined back. Like it's a very vulnerable space. Fortunately, the people who are providing ketamine therapy, they're typically licensed and they've been approved by their medical boards, and they have, you know, gone through all the steps and whatnot. But still, you still want to do the research.
Yes.
And I guess that's the thing with these plant medicines and the underground work, is one of my concerns is that it isn't licensed, right? There's not a shamanism school that someone can go to for 4 years and then do a residency in specializing in trauma and shamanism. I mean, that model could be there, but it's not like certified as rigorously as in the United States and the traditional model. So there can be some stuff that happens.
Yeah.
And we know that, and there's news reports of some shady stuff occurring. And whether that's sexual assault or whether that is abuse, like these things can happen. And so I think having the individual be really discerning in who they're working with is going to be crucial.
And would you say there are physical or mental components that people need to be aware of in themselves, like mental health disorders?
Yeah, for sure. Like I think classically we know about schizophrenia and psychoses. If someone has a history of that, then that would probably be not wise, because when people enter non-ordinary states of consciousness, it could trigger them and they could stay stuck in a psychotic state. And I've read case reports where someone goes to Peru or Amazon or Ecuador or Colombia, and they'll do these sessions and they'll get stuck in a psychotic state. Right? They may believe they're Jesus. And then they'll see their traditional doctor and they'll get started on antipsychotics, 3 months, 6 months. So I've heard of that. So that's classically the big one. And, you know, if someone's on serotonin, selective serotonin, SSRIs, like that would be
Mm-hmm.
possible danger because there's the risk of serotonin
Mm-hmm.
syndrome. And then if someone's on MAOI inhibitors, because one of the active ingredients of ayahuasca is the MAOI inhibitor. And then, yeah, so cardiovascular
Mm-hmm.
functions is another
Why is
issue.
that counterindication?
Yeah, so there was a study looking at ayahuasca, and what they found was that when someone initially consumes ayahuasca, the sympathetic nervous system ramps up.
Huh.
And then the parasympathetic system later down the road, they get calm.
Mm-hmm.
So initially it's like a ramp up. Now, when the sympathetic nervous system activates, it increases heart rate and it
Mm-hmm.
increases blood pressure.
So you would say that the people with the higher blood pressure would also be a little bit on the caution?
Definitely, if someone has a history of, severe hypertension, if it gets really high, like that could, the blood vessels can only tolerate a certain
Yeah.
amount of pressure, but if it's too high, like things can rupture.
Mm.
And so these are all these theoretical risks that could occur and to be cognizant of, because yeah, it can stimulate. Or if someone let's say someone has a history of coronary artery disease and they don't even know for some reason,
Yes,
right? And then
exactly.
now the heart's beating really fast and they're beating faster and stronger. Like that could potentially create issues, right? It could trigger a heart attack potentially.
Mm-hmm.
So I think to be aware, yeah, like there's a lot of contraindications. There's medical issues, psychological issues. And again, going back to like, who am I working with? Like, do they have this knowledge? Like, is it going to be safe for me? The other thing that I do want to mention is if someone has a history of active substance use disorder.
That was,
right?
yeah, that was my next question.
So if someone's like a drinker,
right,
and then they have to do the dieta, and now they're going into seizures or delirium tremens because they've been doing, no alcohol for X number of days, and now their body's like, hey, if they've been drinking for quite a period of time, like that could be
dangerous.
That could be dangerous. And I've actually heard about that happening where someone was having seizures during one of the ceremonies.
Oh, wow.
Down in the Amazon. So yeah, I think really being cognizant of finding the right person and team to work with.
Right. And are there any counterindications like substance related or health wise or well, you've mentioned mental health with ketamine, like schizophrenia, for example, is you would screen them out?
Yeah, exactly. So the person will reach out to our clinic and we'll screen out a lot of people, right? That may not be safe for them.
And the thing is, like, to the degree, right, we still have to rely on what people report, right?
True.
Because we can't really verify that unless they're not reporting.
Well, I've had one patient who had a history of heart attacks, and he said, "Hey, I want to do, ketamine therapy, but I know that ketamine is going to increase their heart rate and blood pressure."
Right.
So I said, "Hey, maybe it's wise, and before we treat you, I want you to see your cardiologist and get a stress test."
Right.
Right, and so we can screen people and make sure that it's going to be safe. And a stress test is where they run on a treadmill and make sure that the heart's functioning adequately when it's under stress. Now, with the stellate ganglion block, there's not a lot of contraindications. I would say the big ones are if someone is on blood thinners. So if they're on like warfarin or Eliquis or Pradaxa, these blood thinners that some people may take, because we are entering a very delicate space in the neck. So I would say there's less contraindications for the SGB procedure itself.
And with ketamine, like, because I have not heard any, for example, drug use, alcohol use, how long do you need to abstain, or what are there any?
We typically, so if someone is an active daily drinker, then I would want them to be free of it for, 30 days.
Oh, wow.
Yeah,
30
so
days.
30 days. But if someone's like a social drinker, they're like, yeah, I go, have a glass of wine 1 or 2 times a week, then we say 5 days. So it's really variable depending upon their history. And so we do a really thorough screening of their prior substance uses, whether it's psilocybin or MDMA. Like I'm curious to know, to see what their experience was like and how long they need to abstain from various substances.
Right. Wow, 30 days. That's a long time for a lot of people. Yeah.
Yeah, and I'm in particular because alcohol is so prevalent.
Exactly, and it's
right?
legal
and
it's
legal, and
available.
everyone, it's quite common, and causes a lot of disease, and people get dependent on it.
Yes, exactly. That's my point. It's like 30 days for a lot of people is a very long time.
Yeah.
So having had the experience of working in the ER, and also running a ketamine clinic now, and having experience with plant medicine, because it's quite a unique position to blend all these three elements. It's like, is there a way that you see maybe a pathway for plant medicine entering? And when I mean plant medicine, I guess it's a little more beyond ayahuasca. So ayahuasca is like a straightforward psychedelic psychoactive effect. But there are other master plants or plants, the doctors of the forest, and a lot of them we even have in the northern America. So there's Chinese medicine exists, and there's still, like you mentioned, bias. Do you have a vision or idea or how this type of medicine or this modality or technology can enter and integrate with the allopathic medicine?
I think it's going to be slow, like number one. And one example of this is medicine is very slow to change. There was a JAMA publication, and they said on average, if there's something new that comes out in the medical field, it takes about 17 years for that to actually be put into practice. So medicine is very slow to change. And the classic example is hand washing. Back in the 1700s, doctors would not wash their hands prior to delivering babies. And so a lot of doctors back in the days, they would go from working on cadavers for their human anatomy, dead bodies, and then they would go straight from that without washing their hands to delivering moms. And that led to like infections, of course, right?
Wow.
There was a doctor, Semmelweis, who said, hey, why are the moms who are being delivered by doctors, why are they getting all these infections? Whereas the moms being delivered by midwives, they were not getting as many infections. And so he hypothesized, what if we had them dunk their hands in chlorine water before they delivered? And so he did a study, and he's found that the rates of it was called puerperal infection, childbed fever. And what he found was that when the doctors washed their hands between working on cadavers and delivering, that the rates of infection went down.
I bet survival rate too.
And the survival rates, it increased the mortality, maternal survival rate. And then he had this data, and he showed it to his other colleagues. And you know what they told him? You're wrong. We don't need to wash our hands. We're gentlemen. We always have clean hands. And this took about 50 years from him discovering to actually being put into practice. Now, of course, we wash our hands and sterilize and do all this. So I tell this story because medicine is slow to change, and that's the classic example. Now, with ayahuasca, I think there's going to be, what'll be crucial is the research, right? And so there are countries where it's legal and it's actively like, hey, this is our national medicine. Brazil would be one classic example where, you know, under religious affiliation with either the Santo Daime Church or the UDV Church, like they're allowed to, you know, use it, or whether it's in Peru or Colombia. So it's possible that the research could be done where it's currently legal, and then we can say, well, based upon the study done in the Brazilian hospital or Brazilian doctors or, you know, Colombian groups, like we found X, Y, and Z. And that is occurring now. And so they are doing that research. So I think the data is going to be there. But as you and I know, data is not what moves people.
Yes.
It's stories.
Well, that's why we're doing what we're doing here. It's the stories.
It's the stories. That's what moves people is stories. And we say examples. We say we make decisions based upon emotions and justify it with logic.
Yes.
Right. So I think the story component, and how do we share the story in a powerful way, and then that'll move minds, hearts, and spirit, and then we justify it with the data.
Yeah, yeah. I love that a friend of mine mentioned somebody who delivered like a speech at a conference, and when they came off stage, she said to the presenter, she's like, "You spoke medicine." And I thought that was so powerful, because like that's how it happens. I think like specifically in this domain, in this territory, it's like, yeah, because I think like it's the stories and also who we are being. And I think the second movie, Exploration, is like, well, people who have worked with the medicine and have experienced something life-changing, like who are they today and what are they doing? And so I think like it's really amazing because you're one of the people who have been doing ER work and doing completely different, having gained all that experience and now um, moving forward in a different capacity, and all that came before is, crucial foundation for what you're doing today. So yeah, thank you.
Thank you. Thank you so much for that acknowledgement. And, I do want to touch upon the concept of stories, because that's what's always moved us, right? 100,000 years ago, as humans sitting on the savannah, we would sit around the fire and tell stories, right? And so that's what really moves humans and society that's a large component, because that's what we just did for 100,000 years.
Exactly.
Right? We would just sit around the campfire and share stories and lessons and insights, and that's the oral tradition that just gets passed down from one generation to the next.
Yeah. It's interesting because like for the Shipibo tribe, the one that we made the film about, the first film about, majority of their, till very recently, they didn't even have like written alphabet, or it's all oral. And it's a lot of their knowledge is passed through actually the medicine, like teaching directly in the medicine way through consuming ayahuasca, through doing dietas with master plants and learning this way through the teacher. And that's how the knowledge was preserved up until today. And isn't this amazing? We know that they at least are, we don't have exact date of their history, but it's thousands of years without any books.
And this reminds me, because I was treating a patient last week, and she told me that she was in Maui and she was snorkeling. And when she was snorkeling, she could hear whales singing to each other.
Yes.
And she told me something fascinating, that whale pods will share songs with each other. And based upon what songs they're singing, you can tell which pod has interacted with which pod. And so the whale it has a huge brain. It's huge. So of course it has a huge brain. And these are really smart creatures.
Yeah.
And it just tells me, going back to the song, going back to the story, maybe it's not just humans.
It's not. I agree, because like, even if let's say we go to the Bible, right? And we say, before anything, there was a word, and the word is sound, and sound is light. So even if we like, just like take out the dogma, but just like, this is a book and this is a story, right? Like that we've been reading for thousands of years. So the sound is really important. It forms reality, and we actually want to explore this idea of the language forming reality, because if you speak multiple languages, you know that the way you can express yourself in one, you cannot directly translate it. You have to speak, find equivalent, right, to deliver it in a different language, because the mentality is different. It's like a whole different mindset, speaking a different language. And so how powerful the language is in informing how we perceive reality.
100%. And I thought a lot about the word insane. And I want to share this because insane is broken down into two words, in, and sane, which comes from the Greek or Latin root sanus. And if you take sanus, it actually is translated to sound, meaning that someone who is insane is without sound. And this is where song comes in, where sound comes in, where frequency comes in, language. Because if you break down the word, and I love breaking down and thinking about like roots, like, hey, where does that word come from? And why do we say insane is, being psychotic? It means being without sound.
Yeah.
And I know that
ability to navigate.
Ability to navigate. And so, yeah, the song is really important. Music is really important. And, there's that classic quote, music is the language of the soul.
Yes, I love that. And I agree about the songs. And I think that is true, because all animals pretty much exist through the sound. And not only animals, but also reptiles, insects, pretty much almost anything emits sound to some degree.
Birds.
Yeah. Yeah, that's a really an amazing point. And I think it was Nikola Tesla who said, if you want to understand universe, you need to think in a form of vibration, which is like so true because like I mean that's how we came up with radio and television.
And
So
speaking of
it's a
vibration,
uh-huh.
if you think about it, let's get to the biopsychosocial, going back to that. Well, what are cells made out of? Proteins. Well, what
Mhm.
are proteins made out of? Subatomic particles. And what are subatomic particles? Frequency, right? If you look at the proton, the neutron, the electron, it's literally a ball of energy. And guess what we're made out of? Little tiny balls of energy.
Energy.
And so this is where frequency can be really powerful. And, I think a lot of traditional doctors may not be aware of this concept, but yeah, I think the frequency and vibrations
Mm-hmm.
that people resonate and bring
It's
out,
very
it's very
powerful.
powerful. I mean,
Sound healing is very powerful.
and just like you can even like go into a room, right? And you're like, oh man, the vibe feels off or
Mm-hmm.
the feeling is off. And I think what we're responding to is frequencies and
Yeah.
vibrations.
Yeah. And I like this idea that we constantly translate vibrations. We're not taught to understand it that way, but we understand like sound, our sight, our sense of smell, all
It's
of
all
this,
vibrations.
it's all
Yeah,
vibration.
literally the ear, the hearing, it's literally the eardrum,
Yeah.
which is vibrating, which transmits to the cochlea,
Yeah.
and then from the cochlea into the brain, and it's creating a sound. But it starts with the vibration of the eardrum.
And it's so fascinating because in the Ricardo was telling Dr. Joe Tafur, who said like, well, people come here and they think it's about ayahuasca, it's about this, it's about that. It's about the songs, it's about the sound and how the songs affect the space, and therefore it interacts with the medicine, and medicine interacts with us, and how this is kind of like a language. You don't have to understand when they're singing verbally in order to understand what is happening.
Totally. And this is what's Dr. Stan Groff. When for those of you who don't know, he was a psychiatrist, and he did a lot of LSD research back in the 50s when it was legal.
Mm-hmm.
And when it became illegal, he started doing holotropic breathwork.
Yes.
But part of holotropic breathwork was not only the breathing rapidly and deeply, but he found that the music played such a huge role in the therapy. And so he has guidelines about music where it should be nonverbal, where it should be something not familiar, where if it is going to be verbal, it needs to be in a different language so that the person doesn't understand
Oh,
it.
that's
So he has
fascinating.
recommendations on
Yeah,
how he
that's
uses
fascinating.
holotropic breathwork music. And so again, what I do is I read books from Stan Groff or from Carl Jung or from Aldous Huxley, and I'm like, oh, there's an insight, there's a
Yeah.
nugget, here's something interesting, and I just bring it all in and incorporate it into our practice.
Yeah, that's amazing. Well, that's amazing. Thank you, Sam. Taking it back, we have like new appointees in the government, and there's some perceived opportunities for these. And our new Secretary of Health is also a former addict, which is for me is exciting because I'm like, somebody firsthand who knows what that's like is finally gonna make some decisions for those people, because I feel like addiction is a huge problem in our country. So do you have any thoughts on this? Or
Yeah, so we have the new Secretary of Health of HHS, and he's a proponent of psychedelics.
yeah.
And I think that's exciting in a way because, it could open up access. And with the FDA, as you and I both know, they rejected MDMA
Yeah,
therapy back
unfortunately.
last year.
Mm-hmm.
But now the VA is funding a large study with
Ah,
MDMA and PTSD and the veterans.
uh-huh.
So there's actual US government research funds being devoted in the
I love
VA
that.
using MDMA. So there's an opportunity there, which I'm really excited about. There's also decriminalization bills that have occurred. So, for example, Oakland decriminalized natural medicines, Arcata, California, Seattle, Portland. We have decriminalization occurring in Colorado State, Oregon State, counties in Michigan. So there's just a list
Yeah.
of places in the United States where it's being decriminalized. So I think the doors are opening.
Yeah.
and this wave is occurring.
Mm-hmm.
And who knows what the future will bring.
Yes,
But
exactly.
it is a very exciting time. I think for me, what's going to be crucial, because we had the same thing occur back in
Yeah.
this back in the 60s,
Mm-hmm.
right? But then it just got shut
But
down.
I also feel like back then we had a little, it was a little kind of more looser without the understanding and the experience that we have today.
Totally.
I also, I have this idea of it's like, well, maybe it is happening exactly at the speed that it needs to be happening, because we also as a society need to acclimate to these ideas and develop protocols and develop ways, because if right now we had gates were open and we had floods of people, we just don't have the ways of even providing.
I mean, I think that's exactly it,
Yeah.
Sasha. If we just open the floodgates, then it can lead to bad outcomes. And I think that's what happened in the 60s, where the
Exactly.
floodgates were wide open. Timothy Leary was saying, tune in, tune out, drop out,
Whatever that
etc.
meant for
Whatever
him.
that meant.
Yeah.
And so, yeah, that was scary because
Yeah.
it was too dramatic.
Mm-hmm.
And I think, if we look at evolution, sometimes the gradual approach is the best approach. And they say God's denials are not God's delays.
Yes.
And so maybe things are occurring at the appropriate speed. And what's different about this time versus in the 60s and 70s, it's, at least from what I'm seeing, there's science occurring.
Yes.
It's more regulated. It's occurring in doctors' offices. And I think in that spectrum, there's a bit more safety.
Yeah.
And credibility, maybe rigorousness in research. And even let's, go back to the FDA. For them to even consider MDMA, like they allowed it to go through phase 1,
Yeah.
phase 2, phase 3. Like that's a win, right? That's a big deal that they were even able to get the research approvals.
Yeah.
Although they got denied at the final phase, they said, go back and do more research. So to me, maybe I'm seeing the silver lining in the cloud, but
Exactly.
that is actually for me a big step versus them to not even be allowed
Yes.
the research opportunity at all.
We've, I think it was Robert Kennedy who talked about it, and then we heard it from some people that we know that are very tightly involved with AA, who were talking about this possibility of the recovery treatments. Like, so right now they have like recovery, what are they called? For people on with substance abuse, they're called not recovery, rehab. Yes, rehabs. And some of them are more effective than others. And why? What's happening? And so there are apparently some of really good rehab centers in California. And part of why they're so effective is because they're kind of like farm built. So people engage with animals, people engage with growing vegetables. They are going back to being engaged with the land, being engaged with other living beings. That also helps to sort of regulate back to this idea of interconnectedness. And I really like that. Like, okay, well, I think that's a great idea. If we could slowly start introducing some helpful medicines, and people could, work the land, work with the animals, and that would be amazing.
Yeah, I mean, we forget that as human beings, we are nature.
Yes.
We are nature, and no matter what, like, yeah, we're nature, and to reconnect with that, knowing, because it's not actually disappeared, I think it can be really powerful to whether it's going into the land or working with animals. Horse therapy is a big thing, of course. So yeah, connecting and knowing who we truly are, I think can be profound in healing.
Yeah, I think the future is exciting, no?
I think it's very exciting.
Yeah.
And there's that saying, I think it was Peter Drucker who said, the best way to predict the future is to create it.
Yes, indeed. Indeed. And that's kind of what we want to do, like connect with people who do have a vision, talk about it, and tune in. Yeah, not drop out. Drop in. Sam, it's been, do you have anything that you would like to say, like as a closing, and in terms of your work, in terms of how to get in touch with you or where to find information about your practice?
Sure. So for people who are interested in getting ketamine therapy or stellate ganglion blocks, they can come to our website, resetketamine.com, resetketamine.com. It'll be in the show notes. And then for doctors who are interested in opening up their ketamine practice, I do consulting and have created an online course with my amazing partner, Kimberly Chan. And so they can go to ketaminestartup.com or just Google, how do I start up a ketamine clinic? We should pop up as the #1 search. What else? We have a podcast. So it's called the Ketamine Startup Podcast. You can find it on Spotify, Apple Podcasts, YouTube. So people can look that up. And yeah, feel free to connect with me. We're on all the social medias, LinkedIn, social, Instagram, Facebook, etc. You can just look up Reset Ketamine or Ketamine Startup.
Okay.
And then the one last plug I will do is for doctors who are interested in learning how to do the stellate ganglion block. They can go to learnsgb.com. So that's a new venture I'm starting with another colleague of mine, Dr. Sarah Herman. And we are going to be teaching doctors like, hey, how do I do the SGB procedure? So really, my purpose is helping patients using transformational therapies and medicines. And number 2 is educating other doctors and clinicians about, hey, what's out there? What's available? What's cutting edge? That's really what drives me.
Yeah, amazing. Amazing. And do you have any kind of final statement in terms of your vision, or what would you like to have happened in the future?
What's coming up for me is this little thing here, which Sasha, I'll show you. So we have a like die here, essentially. It's one die. And if we say this is trauma or depression or anxiety, we have this here. And one of the ways that we can address it is, instead of tackling the big box by itself, you can do a little magic.
Oh, wow.
And now you can break it down into tiny pieces here, which are much more manageable.
Oh, wow, that's really cool. There's a cool
And so now, instead of this one big thing, you have multiple little things, and you can help process and integrate it. And I think that's where these medicines come in, is taking something big, it feels insurmountable, breaking it down into tiny little pieces. And there's the joke, you know, how do I eat an elephant? One bite at a time. And so when someone is suffering from depression or anxiety or addiction, like, yeah, let's break it down into small pieces, and some of these medications can help.
Yeah, amazing. Thank you. Thank you very much, Sam, for your time and for your friendship and for your knowledge and sharing it with us. Thank you very much for joining us. We hope that this was informative, entertaining, and helpful. And we are hoping to see you next time.